Hello, everybody. I'm Steve Goldman. I'm the director of the Center for Free Enterprise, and welcome to the first event of this semester for the Menard Family Lecture Series. Little housekeeping: if your professor is offered extra credit for attending, you need Cardinal Flight credit, you're in the reading group for the Center for Free Enterprise, make sure you scan the QR code when you walk out the door and fill out the survey. Make sure you put your name on there and what you need credit for. If you're here not for those reasons, please scan the survey and give us your feedback on what you thought of today's event. We have 2 more events coming up this semester, and they will be here in the auditorium at 4:30. And 2 of our events this semester are on the issues of poverty and homelessness, and today's is homelessness. And then on March 25th, Martine Burt will be in town to discuss his book, Who Owns Poverty? And he's got a method of looking at people in poverty and trying to figure out what they truly need help with instead of just this one-size-fits-all method of dealing with poverty. Our 3rd event will be the following week with Ryan Yonk and Phil Magnus, and they'll be examining the American economy at age 250. So I hope you can attend both events. After today's discussion, we'll have time for Q&A. Please let students ask questions first. Also, please get right to your question and don't go on with some diatribe about something you believe and blah, blah, blah. I could do this forever, right? Don't do that. But there'll be microphones in the back. We are recording this, so I would ask that you go to the microphone and ask your question at the microphone so we can record what the question is. So we're very fortunate today to have a panel of experts on the cost of homelessness. Our panel moderator is Susan Buccino. She's executive director of care at the Arthur Street Hotel. I'm going to give her more, I'm going to let her give you more information about her background and introduce the panelists. So Susan and panelists, thank you guys for coming. Really appreciate it.
Thank you, Dr. Bowman. Glad to be here. So I am Susan Buccino. I am the executive director of care. We operate at the Arthur Street Hotel, which is not too far away, and provide temporary shelter for people who are moving into housing from the streets. So most of the people that we serve are chronically unhoused and have a lot of behavioral health issues happening that keep them outside. And our job is to get them into housing and keep them in housing. We have an amazing panel here today, and I want to let them introduce themselves in a second. But first, I want to set the scene a little bit around homelessness in Louisville and what we're doing and how much, just some initial thoughts about the cost of homelessness. So on a given night, Louisville is home to nearly 2,000 people experiencing homelessness. In 2024, over 12,000 people were recognized as requesting local services for homelessness at some point throughout the year. Last year, in addition to these people that fill the city's overnight shelters to capacity, over 600 individuals were identified as sleeping outside on a single night in January, although we know many others remain unseen for that count. Nationally, it's been estimated that as many as 40% of individuals experiencing homelessness report that they stay unsheltered, so in camps or on the streets, in their cars, or in other places not meant for habitation. Rising rents and persistent inflation have increased the number of individuals becoming homeless. A 2020 study out of the U.S. Government Accountability Office found that a $100 increase in the median rent was associated with a 9% increase in homelessness. Rent increases also make it more difficult to exit homelessness. Housing costs in Kentucky increased by 26% from January of 2020 through December of 2024, and the median rent cost was $1,346 last year. In 2022, Louisville's eviction rate was 13 filings for every 100 rented households, equivalent to 44 evictions every day. Nationally, the rate of homelessness rose by 18% from 2023 to 2024. It's important to recognize that homelessness is often precipitated by trauma, and homelessness itself is traumatic. Housing instability and homelessness are intimately linked, and people most often become homeless, both initially and repeatedly, because of poverty, the prohibitive cost of housing, and systemic discrimination. In fact, individuals experiencing homelessness are often employed full-time in low-wage jobs. About half Louisville's homelessness population reports that their last residence was in one of the 10 poorest zip codes of Jefferson County, which reflects our legacy of redlining. And for our segregated city, that means that homelessness disproportionately impacts African Americans. The other half of the population comes from every zip code in Jefferson County, so this is widespread. In July 2024, Kentucky implemented the Safer Kentucky Act, which created the crime of unlawful camping on public property, resulting in hundreds of citations within the first year. As you can imagine, someone who is unhoused may have difficulty paying a fine or appearing in court, and so multiple violations result in incarceration. Incarceration is then a barrier to moving into housing. In response, LMPD officers have been dedicated to enforcement. Louisville Metro created an unlawful camping docket, and funding has been designated toward a camping court diversion program. To state all this simply, we now criminalize homelessness and circulate folks through the legal system, which results in sustained homelessness. The only solution to homelessness is housing. Permanent housing. However, of those who use homeless services, typically between 15 and 30% move to permanent housing. In addition to insufficient emergency shelter, our community does not have enough affordable housing to house every Louisville resident. The 2024 Louisville Housing Needs Assessment states that Louisville has a severe shortage of housing units that are affordable to our poorest households, particularly those earning less than 50% of the area median income. The assessment reported that we need more than 40,000 new units to address the need. And Louisville is not alone in this. Nationally, no community meets the demand for affordable housing. So, what does Louisville do to address homelessness and families and individuals who experience it? Last year, the U.S. Department of Housing and Urban Development awarded Louisville's homeless services agencies $23.3 million for 48 programs to house individuals who've experienced homelessness, managed by 17 agencies throughout the community. This funds a coordinated entry system and a system-wide data sharing platform, in addition to some outreach services. Some of this funding also covers rent and supportive services to assist households in maintaining housing. Emergency shelters and homeless prevention services are funded through Louisville Metro's budget, some of which is also HUD money that flows through locally. Louisville Metro budgets for homeless initiatives to fund several additional services that aim to reduce barriers to get back into housing. Local organizations rely on these government grants, philanthropy, and local donors, individual donors, which requires that they have dedicated staff for managing fundraising. On the housing side, Louisville Metro has historically added an average of $10 million to the Affordable Housing Trust Fund, and the state issues tax credits to developers to assist in offsetting the costs associated with building that might not be recovered by affordable rents. Despite millions of dollars in this system, nationally, communities are not funded at the level that would enable them to help everyone experiencing homelessness within their jurisdiction, nor have we been building housing to close the gap. So that's a little bit of background, and I've established now that both individual housing and homeless response system are both really expensive things. So there are a myriad of direct costs and indirect costs, but because homelessness is an issue that affects all Louisvillians, Louisville needs cross-sector collaboration and community awareness and education. And so today, our panelists bring varying perspectives on the cost of homelessness. Our hope is that you walk away from this discussion not only with more insight to the issues, but also an idea of how businesses can contribute to community solutions and to create a community in which we can all thrive. So I'm going to ask our panelists to introduce themselves. And panelists, how does homelessness show up economically in your day-to-day work? Not just morally or socially, but in dollars and time and systems. Go. Start with you.
Okay. I'm Ryan Dischinger. I work right now, and I have for the last 11 years as a public defender here in Louisville. So all of my clients are indigent. Everybody that I represent has experienced or is experiencing poverty, is unable to afford counsel, and I do entirely criminal defense as part of that. So in terms of how homelessness has always been a piece of what it is that my clients are experiencing, housing instability is extremely common and has been common for years. And as Susan noted in kind of the summary there, in 2024, the Safer Kentucky Act was passed that included a statute on unlawful camping. It also increased penalties for just about every crime you could possibly imagine, and I think is going to continue to result in significantly more incarceration across the board. But as in terms of the camping statute itself, one of the things that I've started to see in my day-to-day as we look at the people that I represent is I have clients now that are scared to tell me that they don't have a place to live. I am used to having difficult conversations. I'm used to having people not necessarily want to tell me everything, but 5 years ago, I don't really have a stable place to live. Oh, I'm staying on the streets was a pretty easy thing for somebody to reveal to their lawyer. Not so much anymore. Now people are scared. So this is something that I didn't think that even representing people who are dealing with extreme poverty for years, homelessness itself wasn't necessarily something that I thought about a whole lot until we started seeing this increased trend toward criminalization and how people are reacting to that and the ways in which our city is helping to implement it. So that's kind of my perspective.
Thank you.
I'm Rebecca Fleischaker. I'm Executive Director of Louisville Downtown Partnership, and we are an organization that works on downtown vitality, economic growth, making sure downtown is a welcoming neighborhood and feels good, feels and looks good. And that means for everybody. So the work that we do, we've got kind of two sides of the house. One really is our business improvement district, and we have ambassadors, which is the most visible part of that work, who walk the streets and pick up litter, help remove graffiti, do special projects in terms of power washing the sidewalk or hanging banners and greeting you as you walk down the street. And if you look like you're lost, they will ask you if you need directions. The other side of the house is more of a 20,000-foot view, strategic visioning of what do we want downtown's growth to look like, and that takes a lot of public input. Nothing in the writing of our mission says to work with homeless individuals or street population, except that it impacts everybody's experience on the street every day, and it impacts what we're trying to do too. So we do have a small part of our ambassador team are social outreach ambassadors that will connect people to services. We work with the city's outreach team when it gets to the point of trying to make referrals. We can drive people to Peace or to other places for some services. We're trying to help connect these people to get what they need. Susan's point about permanent supportive housing is something I've dipped my toe in. It's not something, again, that is part of my my work on paper, but it is something that is really important to helping downtown be the center of the city for everything that happens in downtown.
I'm Lisa Dischinger. I am one of the founders of LDG Development. We're an affordable housing developer here in Louisville. We started here in Louisville. We've been in the business for over 35 years. One of the things that we do is we try to put people in housing and keep people in housing. We deal with the homeless issue on a day-to-day basis in many, many different ways. We try to limit homelessness by trying to prevent evictions. We have to deal with the fact that people are paying more than 30% of their income on rents. trying to figure out through food pantries, after-school services, any way we can to help people not lose their housing. It's an economic problem for us as well as a social issue for us. We try to stop that. On the other side of it, we're trying to get people into housing by building housing. We do affordable housing, so it's anywhere from 30% on up to 80% AMI. We are short of housing here in Louisville, so we do a lot of fighting of neighborhoods and zoning. The cost of doing that does nothing but raise the cost of rents and materials. We also own our office building here in downtown Louisville. One of the issues that we have is we have homeless that are roaming just like everyone else does. We have people that are trespassing, littering, all of that. We get code violations on properties that we own. We are racking up fines all the time from the city. They are public nuisance fines. Other businesses I know are getting the same problem through codes. You know, some of the unintended consequences of clearing camps and being able to see a pretty downtown is the fact that we are clearing homeless and they're going to private businesses or going to private land, and it's falling back on the business community. So the economics of that is it's just a big circle. Mm-hmm. So our business is trying to do everything we can to put people in housing, keep people in housing. We are a big, obviously, supporter of Arthur Street Hotel. It's one of the things of a major initiative that we took. We brought Bezos Academy to Louisville, trying to get people at the very beginning. Trauma is a huge part. Every time you evict somebody, it's a trauma on the family, it's a trauma on the children. We know that. But what do we do as a society to try and stop the bleed?
All right. So, Rebecca, I'm going to start with a question for you. I spoke a lot about the cost of direct homelessness in terms of services, and you mentioned now the vitality of downtown. Can you talk about the indirect costs that are associated with homelessness and how downtown vitality plays?
Sure. So I actually had a different role during COVID. I worked for the city's economic development department, and so I still worked with a lot of downtown business leaders. And there's a couple of different facets of the cost of two businesses, I think. One is street level businesses who have retail on a first floor, as opposed to somebody who has a corporate office that's upstairs or in a tower. And I think that it's important to know this conversation has changed a little bit since COVID, because during COVID, encampments weren't allowed to be moved, and there was this tension between the business community and the city, or maybe it was the feds at the time that had this rule, because it was impacting what people saw on their way into downtown. People that were still coming to the office didn't like to see the encampments, and it was making clients not want to come or their employees not want to come, and that was the complaint. And then after Mayor Greenberg took office, he very much took an opposite stance, and encampments were cleared to make the point that these people were not to stay in the same place anymore. And I think because of that clearing, and people were spread really hither and yon, and it kind of spun up a lot of anger and confusion. Then I think the business community started to take a different understanding and say, oh, well, they don't have anywhere to go. So there was a different level of understanding of what that meant for the community. But to get to your particular question, that indirect cost is a couple of different things. People who hadn't been downtown because of COVID and who had only been seeing things on the news, not just social justice protests, but also the rise in what we were seeing in the unsheltered community on the streets, didn't want to come back to the office. And I think there was a lost productivity that I would say I wanted our people to be in the office. There's a lot to be gained by working together And same can be said for your clients or your customers that you need to come in that you're doing business with. And so I do think there was a lot of customers that didn't come to retail or to the street level businesses anymore. So a lot of those don't exist anymore, actually closed up. And there's a cost to businesses for extra security because there is trespassing, like Lisa said, there is trespassing. There is people having to use the bathroom, and there are no public bathrooms, and this is where they go. And so there's also cleaning efforts and having to sanitize your sidewalks and go out and make sure that your sidewalk is clean, and that is the responsibility of the adjacent property owner. And then your own people wanting to come back to the office. And I think there has just been this undulating change in people's understanding and willingness to put money towards these things because it has to happen. But all the while, I just really want to make it clear that there's been a greater understanding that there has to be this effort toward more supportive housing, more affordable housing. And I think that is where businesses are now perking their ears. The mayor and a group of us brought Milwaukee, I don't know if we're going to talk about this today, but brought some folks from Milwaukee to talk about what they're doing there for their homeless, to reduce their homelessness on the streets. Beyond the Bridge is a documentary. If you haven't seen it, I highly recommend it. And I don't know when that was, August, I think. And there was, it's just been launched. It hasn't been super strong out in the community yet, but what can we do as a community, as businesses, as individuals to help? And there's a lot we can do.
Thank you. So Ryan, we've talked then about the Safer Kentucky Act and criminalizing homelessness. And so while maybe homelessness doesn't impact visibly downtown because it's disappeared, then if it's criminalized, then what are we paying for as homelessness moves to the criminal and the legal system?
Right.
It hasn't disappeared, by the way.
No, it hasn't disappeared.
No, it hasn't. It hasn't
What are the
disappeared
economic-
because it's
yeah.
not going to disappear. But we could talk first about the cost of somebody spending a day in jail, which is $161 as of, I think that was fiscal year 23. So probably more now. It goes up every year. We can talk about the overcrowding in the jail as it stands. We can talk about a few years ago when we had a string of deaths in the Louisville Metro Department of Corrections due to a whole bunch of different factors, but one of which I think was the overcrowding and then just general terrible conditions within that building. We can talk about the cost that it takes once you create a court case around. So if you have an unlawful camping citation, that results in a case. And that case will have a single number. It has to get placed on a docket. At that point, it'll be on for a date and time. And there's a prosecutor assigned to it. There's a judge that's going to preside over that docket. There is a public defender a lot of times that will get assigned. And we've been handling defense on just about every unlawful camping citation. There's one case where a private attorney showed up. But I think he was trying to do a good deed, and then I ended up handling the case anyway. But anyway, so we handled just about every one of them. We have about 20 or so lawyers that end up showing up to a camping docket. And that docket happens at the end of the month on Wednesday at 1 o'clock. So we'll have about 20 lawyers that will show up to represent various clients. They'll spend an hour or two in court for that. And it's not the same 20 lawyers every month, but we have them show up. They're all getting paid. The judge is getting paid. The court staff is getting paid. The police officers that are walking around and that are issuing these citations are getting paid. The vast majority of the camping citations are being issued downtown by members of the Downtown Area Patrol. I have some amount of data here, but anyway, going between July of 24 and the end of November of 25, we're talking 262 different citations just specifically for unlawful camping. And I think one of the things that is probably worth including in the context here is that that's not necessarily the only charge that somebody will get if they're out on the streets. Criminal trespass is pretty common. Maybe any other number of just different, I think sometimes people refer to them as like quality of life offenses. For a long time, there would be a charge for panhandling. That's protected by the First Amendment, so they don't charge that anymore. Now they charge some local ordinance that has to do with standing near a highway or other various things that are all kind of concentrated around panhandling charges. But all of those result in criminal cases, and those criminal cases require lawyers to defend them. They require prosecutors to prosecute them, all in service of ultimately not collecting a fine, because nobody who is indigent in the state of Kentucky can be forced to pay a fine. And actually, in the United States of America, just generally speaking, you're not supposed to be forced to pay a fine if you're unable to pay it. That's constitutional protection, but here in Kentucky, there is a statute that explicitly says that. So the costs are all over the place, and they come in all sorts of different ways. And what's kind of most concerning about all of those costs is that none of them drive someone towards housing. Not a single thing that I do results in somebody getting housing. Not a single thing that a prosecutor does results in somebody getting housing. And not a single thing that a judge does can cause somebody to get housing in and of itself. What that takes is the people that are working out in the community. And so at best, what we've been able to do, I think our biggest success story on the docket, or at least my biggest success story in terms of clients, was literally because two people from two different organizations happened to be in the same room because of the docket, and and one person from across the room heard somebody's name and said, "Hey, I've been looking for him." That's it. That was the entire benefit of the court process, was that someone was able to find someone else. He didn't show up to court. It wasn't because he was there. It was because they heard the name and they said, "Hey, do you know where I can find him?" Those connections can happen without the courthouse. So we're expending a serious amount of money on enforcement and on criminalization that just doesn't actually get us toward any of the goals that we're hoping to accomplish.
My background is in public health and health promotion specifically, and so that's really kind of my basis for being interested in unhoused population, is that housing is a basic right, and you need housing in order to be healthy at all. And so in this discussion, we're not really touching specifically on the healthcare system, but know that homelessness introduces lots of communicable diseases and infectious diseases, as well as just the wear and tear on the body from exposure, and all sorts of other ways that someone who is unhoused life is shortened, not just their quality of life. But I want to move on to Lisa. Lisa, the first time I met you, I remember very distinctly you saying that evictions do not save you money as a developer. And so, but yet your business is thriving. So as a business owner and a housing developer, how do you balance being part of the solution while maintaining a thriving business?
Boy, and I know you gave me this question earlier, and I've really been thinking about it all day. And when you say our business is thriving, our rents are set in the affordable housing world, and it is true. Evictions cost us a ton of money. We never want to evict anyone. When you evict someone, you've got a turnover, you've got lost rents. Eviction is the last thing we ever want to do. A lot of times people think that we evict just for non-payment of rent. That is not the case. We do have to evict for non-payment of rent, don't get me wrong, but a lot of people that we have in like 30% units are on government subsidies. They are on government assistance. Rent is not the only reason that people get evicted. They get evicted because of illegal activity. They get evicted because they have someone staying with them that they shouldn't. It's usually a safety issue, or they can't keep their apartment clean. We have standards that are set by the government. They come in and they do inspections, and if we fail the inspection, then we lose out on rent. And sometimes we have to evict because we can't help that tenant do the things they need to do to keep their apartment the way they need to keep their apartment. What we need is more caseworkers. We need more support for the tenants who are living in our units, and we just don't have the resources to do that. One of the things that LDG has done is we have put resident services at a lot of our apartment complexes to help with that. It's still not enough. We have people moving into our units that literally have no furniture. They're moving in with no beds, with nothing. They're coming in off the streets, and we're trying to figure out how in the world we supply them with the basic things that they need. We think that we do a better job at that than other affordable housing developers because we care about our tenants. We put a lot of money back into our developments and trying to make our tenants' lives better and able to stay in housing and to prevent the evictions. We do the best we can. We're not perfect at it, but we certainly give it our best. That's about the best answer that I can give you. It's tough, and this business is tough. The rental business is hard. You're dealing with a lot of people in a small space, and they all have to live together, and you try to create a community.
Yeah, and trauma creates a lot of chaos.
Trauma does create a lot of chaos, and you try to give people a stable place. And the longer you can keep somebody in one place and the more support you can give them and the more help you can give them and the leg up, the better you're going to be, the better the apartment complex is going to be, their neighbors are going to be, and the better the neighborhood's going to be. And we just do the best we can with community needs assessments to try to provide that.
The flip side is also true. The longer that someone is on the street, the more difficult it is to rehouse them. And so our goal as a community would be to make periods of homelessness as brief as possible, but without the additional housing and without the social services to move people through to housing and get connected and resources. That's just not always possible. So this is going to be for all of you. Businesses have a lot of influence over local policy and the city's economic well-being. What can businesses do to be a part of the solution? Ryan, I'll throw this to you first just because it'll be from
I think
the
that
non-business perspective of what business
right. Yeah,
do.
like I don't have a business perspective at
Yeah.
all.
But what do you wish from the business community as a public defender?
I think that businesses have a lot of influence over particularly local government. I think that it's really businesses in this community have a lot of very understandable goals, right? They want downtown to look nice. They want to make money. They want their customers to be able to come in regardless of where it is in the city and whatnot. What I think that, and this is not necessarily limited to businesses, but it's kind of true of all of us, but what I think is the most important thing for businesses and just generally in living in a community and in interacting with like their local politicians and everything is to really understand and to think about what the consequences of a particular path are going to be and to kind of think through the next step. So it makes sense that, say, a business would say, I don't want somebody harassing my customers outside of my business. What is very easy to say is, I wish the police would come take them away. And that's kind of a simple solution a lot of the time. And I say it's simple in that it's a pretty easy phone call away. 911's not very hard to remember. But it's also an extremely expensive solution, and it's not actually a solution at all because of a lot of realities. And so what I think is really important, again, for businesses, and I think just for members of the community, is to be thinking through the next steps before taking a particular, like, oh, we want this to happen. Yes, we have goals, and I think a lot of us share those goals, but how do we accomplish those goals? We need to think about the thing that we're going to do. Is that going to accomplish that goal, and is it going to create a lot of unintended or maybe intended consequences, because we want to avoid particularly the pretty significant and I think brutal human costs that come with some of the decisions that we've made.
Rebecca, same question.
Well, I can tell you what has been happening. So I do feel compelled to, I'm a convener. A lot of my job is bringing people together around a cause or around a speaker. Community Care Campus, if you haven't heard of it, check it out. It is a square block that's south of downtown that is developing several different, uses all around homelessness, but affordable housing, and trying to move people along that spectrum of to get to affordable housing. It's taking a lot longer than it should have, but it is getting there. And I know that VOA is who the city is working with to develop that block. They have a family shelter that's open right now. They're gonna have some permanent supportive housing, affordable housing, a community center. There's a bunch of stuff going on that block, but it is really right now about raising money. And I do think this is where businesses need to put their ear to the ground and figure out where they can help, because the business community does have money. I mentioned Milwaukee. We brought somebody from their housing authority and their county government to talk to us about what they had done. That's that Beyond the Bridge documentary I mentioned. That is something that we have started to tiptoe in. So we have a initiative called Home for Good that we the mayor kind of announced it at that showing of the documentary. But it is to show this is where funding is. There is some that's coming in. You mentioned from city, from the feds. And there are vouchers from the Metro Housing Authority that also pay for some housing units. But we've got to be able to marry social services, drug addiction services. I'm sure I said that wrong because I don't know what the correct terminology is. Mental health, behavioral health services with housing. So Sheehan Landing opened last year, and it has permanent supportive housing units, permanent supportive services with the housing units. We need more of that. And this Home for Good initiative is to raise funds where we can come around all the other funding sources that already exist to create those housing units. And I think that's really important for, especially people that just don't know this world, and I did not know this world 2 years ago, just that we've got to sit down and listen and learn about what all is happening right now and what can be done and what needs to be brought to bear. And I think it is government working with philanthropy and with private donors, and it is about putting money towards these things that will save money in the end and that do help our community. Because I don't think anybody would sit here and say, I don't want to help these people. And when you are face to face with somebody and they're struggling, maybe you're not on the same mental acuity level, but you know that somebody needs help, and how are we going to do that? And to me, that is really the bottom line of what we need to figure out. Businesses aren't the only one. There needs to be a lot of help, but I do think that is where businesses can help.
All right, Lisa.
I'm going to choose my words very carefully here. I think that businesses can do a lot of things on the policy side. Businesses are feeling the crunch of the economy, and they can do a lot by just using their voices. When you have people who are roaming around downtown and they have nowhere to use the restroom, there's an easy solution for that if we just use our voice and say, hey, maybe we need some public restrooms. Maybe we do need to accommodate some very simple things, some trash cans. Maybe we do need some area that people who are homeless can do some very simple, basic human things that they need to do. We need to somehow come together in this community and figure that out. Right now, we don't have anywhere for someone who is homeless to go. It is just purely illegal. They're going to get cited for it. until we have the housing shortage under control and we figure out where they can go, let's at least give them some human dignity and some place to do what they need to do. To me, we got to use our voices and at least expect that out of our local government. I understand that community campus is coming along, but that is taking a while, and we need to do something in the interim. And businesses need to kind of look inside themselves and say, hey, what am I doing with my employees? Are all my employees housed? Am I paying enough to my employees so they can pay their rent? That is a very basic thing that a lot of businesses need to look at. I asked somebody about a year ago, they were very proud of the wage that they were paying, and I said, do the math on whether or not your employees can actually live in an affordable housing unit. At what AMI are they at? And they were shocked when they actually did the math. You know, some business owners are a little out of date on what they realize wages need to be in order for their employees to even afford housing.
And it's more than a minimum wage.
Oh, it's way more than a minimum wage. And business owners are shocked by that.
What is the family wage now, supporting wage? $21, $22 an hour?
Yeah. In Kentucky, it's at least $21 an hour. Someone making minimum wage qualifies for Medicaid. Full-time on minimum wage, you can qualify for Kentucky's Medicaid.
You're right. You're totally right. Our teachers, our firemen, you know, people always talk about, I want affordable housing near me. But when you look at what some of these jobs pay, I don't know how anybody can afford to live without that. Our public transportation, we need to start speaking out about that. How do people get around? Ryan had a story of one of the people that lives in Sheehan Landing got arrested in, was it
Bullitt County.
Bullitt County,
UofL
because
hospital.
he got discharged from the hospital and didn't have a ride back to his apartment. So they put him in jail. And he was on Medicaid. And MCO should have given him a ride home. That's what they advertise. But that's not reality. Businesses need to speak up about insurance, about Medicaid. They can use their voices if they can't afford to put money in. And I totally get that. Small business, medium businesses, they're trying to survive. Insurance premiums, everything it takes. Taxes. But at least speak up.
So at this point, we'd like to open it up to questions.
Don't be shy.
I think the ask was that you are able to use a microphone. Do we have? So I know this microphone over here is open.
Yeah, there's one here. I'll ask the first question.
Yes, please.
What would you say is the biggest roadblock we have here in the city from reducing homelessness?
I'm going to say, it's probably not a popular answer. I think our policy on clearing camps right now is our biggest roadblock.
Do you want to elaborate? I have my thoughts, but would you like to explain why?
I think it's because we can't find people to give them outreach. I think it's because we can't take the time to figure out how in the world we get people in housing, and people are hiding and they're incurring more nights in jail, and we got to take more time to get rid of the crimes that they are now doing in order to even get them in housing. And public housing, you can't have charges on. So it's harder.
Ryan, did you have something to add?
Yeah, I mean, I'll just note, like, I think you kind of alluded to what ends up happening is there's an individual who was on the camping docket who got cited in a tent 3 or so times, and after being told over and over again that he couldn't be in a tent under an overpass, in like not in the middle of a sidewalk. I understand that nobody wants the tent there, but it wasn't actually like blocking anything. But he's in the tent. They told him to move, and the next arrest was because the fire department was called because he started a fire indoors when he broke into a warehouse that was empty. With nowhere else to go, people end up in hiding. I assume that everybody's on board with, we don't want people starting just fires inside whatever place they can find. He's now got a warrant for a burglary because that's what he was charged with, for starting the fire inside.
Rebecca, what would you say, having been in the Home for Good meetings and where we
I'm
are?
the least expert here. I mean, the entire spectrum has just failed. We don't have the next place for someone to move. So I do think, I mean, both of these things are right, but I also think that we've got to start moving people into, I mean, if we can get someone off the street into with some kind of transitional shelter and then into permanent supportive housing where they do have those supports. I just think that we have got to be able to build and fund and have human power that are providing those services so that we can start getting people under a roof and in shelter. Because I think that's when people start to stabilize, and it's going to take a long time to trust the process. I think for people who have gone through the process, there's going to be a whole trust thing that they're going to have to know that they really are going to be taken care of, and I think that's going to take a long time.
Okay.
As we know, there is a housing affordability crisis in the United States, and based on what politicians have been saying, it feels like they want to have it both ways. They want to solve the affordability crisis, but they don't want to crash, housing prices, because then you have mortgages underwater. It can hurt economic activity. Is there a balance that can be struck between increasing supply and decreasing the price of housing, and not, I guess, angering current homeowners?
That is 100%.
I mean, can we lower a lot of prices? I think that, I mean, especially during COVID, we saw prices shoot through the roof because of the demand and the supply that wasn't there. And even though I think for the most part, it's that supply and demand is fixed, the prices did not come down. So that part, and I'm not in construction or development, so again, not expert up here, but I feel like there has to be more subsidy to get to affordable, because the market rate is market rate. That's what it costs to build the doorways. And there's got to be some help.
I think you are always going to anger someone, regardless. People don't want new development. People who are in their houses want to stay in their houses and keep their prices high. But as a society, we need to do what's best for everyone. So some people are just going to have to deal with the fact that in some places their housing prices are going to go down. Supply and demand is just a reality. We have had a shortage for a long time. We quit building. We have to start building. It's what's going to get housing costs down, and we need housing costs down. There are other ways we can get some housing costs down. We can stop with the fighting and the permitting and the cost of building. Lawyers make more money off of the process than anybody else. If we cut the lawyers out of the process and we start building faster, we can get the costs down. That's my pitch on,
And as a lawyer, I will absolutely echo, get the lawyers out of it.
Thank you.
I have a couple of questions, hot topic questions and national questions. Susan, the controversy between housing and rehabilitation. You mentioned that housing is the priority. However, many homeless people have mental illness issues, addiction issues, and so on. So when we look at housing, do we place homeless people first and then provide rehabilitation?
Yes.
Or do we combine the two at the same time?
It is a combination. The evidence base is housing first model. The housing first model posits that without a home, you cannot address the other issues without that stability. If you can imagine trying to make appointments and get places from a tent, it doesn't really happen. And as I mentioned, the emergency shelters are full and mostly demand sobriety because it's a congregate setting. So if you can't manage that, you would just basically have to peel off your use or your mental illness and walk into the emergency shelter in order to be accepted there. That doesn't work either. So housing first, but the evidence base is housing first with supportive services. And what tends to happen is that agencies are so overburdened and underfunded that caseloads become really high and the supportive services and the quality of supportive services go down. We also don't have a variety of housing options. We have apartments. We don't have assisted living. There's not a nursing facility in the state of Kentucky that would take someone with a psychiatric disorder. Assisted living is all private pay for everyone and also doesn't provide the level of assistance necessarily that some folks need. So without it being an institution, we still need community-based settings where people can thrive. Before you ask another question, I'm going to jump over here because I think this is a student, and so we need
Well,
to.
I want to make a point because I kind of disagree. I do think it has to be both at the same time, and I do think this is where the money gets really important because I do think we have to be able to fund those social services that are so critical to the people who need those supports, who may not know how to live on their own and haven't done it in a long time. I mean, moving to an apartment without a stick of furniture and just need some help. I do think that's really important.
Yes.
And housing first, to your point, has gotten a bad rap nationally because I do think we need the services with it.
And the regulations around it federally are that someone can make a choice around having case management and that a case manager only has to be there once a month. That is a really easy regulation to meet, but it doesn't meet the needs of the person. And that's where we get confused, where policy doesn't follow best practices and the evidence base.
So I kind of have two questions. My first one is that all of you mentioned encouraging partnerships between government, philanthropic, and private interests. Because of your varied backgrounds, I wanted to ask how much each of you have worked with the Department of Community-Based Services. And then my second question is about the workflow or the workload changing as the year progresses, because obviously our local economy is very tourist heavy with Derby every season, the racing. So how have you guys seen your workload change as our sector has skewed to the tourist heavy section throughout the year?
Okay. Rebecca, do you want to talk about tourism?
Well, I don't know that I understand what you're asking. Are you assuming that the money is going toward tourism, or are you asking if money is being spent elsewhere because of tourism?
I'm asking about your guys's experiences with specifically 2022 and 2023, where the clearing of homeless encampments increased in March and April in the lead up to Derby to try and quote unquote clean up our city.
So I can speak to those because I actually organized those at the time. And I will tell you that we cleared one camp a month. We did not clear through the winter. So our policy was to clear not when there were white flag temperatures, so not at 35 degrees and below, which meant that we didn't clear any camps then in November, December, January, and February, because it's very harmful to people to destroy all of their belongings right before they are going to freeze. So we only put that together once a month, and we did that with city funding and moved people from that camp into a hotel for 9 days as harm reduction. That does not solve problems at all, but it does make it a little bit less traumatic to be able to move to a place the night before, clear the camp without having somebody be there, watch their stuff get destroyed, and then we know that they're in a safe location for that week where we can flood them with services. And so that's the rhythm that we set up. So when March came around and it started getting up warmer, and April came around and it started getting warmer, we looked at what was the most needed camp to get cleaned first. And so we did that in March, and then a second area in April. And then we did one actually the week after Derby, and then continued throughout the year with that. So this administration has chosen a completely opposite tactic, and they clear every day throughout the year. So there is no time for settling. There are no big camps ready for any holiday or special clearing or special events. And then your question about DCBS, that's a state level agency. What kind of experience that covers a range of things? They do not specifically address homeless services in Louisville. So what experience would you hope to see out of that?
I was mainly just asking about, like, every panelist has mentioned the blend of those three sectors, and I know that that is one of, like, our, like, the LNN building is one of the key places where we have our community-based services. You know, they call it that for a reason, but it's like how would you guys, do you have experience working with the local community-based services building any of the outreach programs? Or would you like to see something there because of the, like, oh, we should blend all these three? Does that make any sense? I'm sorry.
No,
I think what she's asking is, would you like us, do you want to see all of the services combined into a central location, or us work better between all the services providers?
How
kind
would
of the
you,
coalition?
How would you guys look at, like, the collaboration looking?
I think it's looking better. We put together a panel. I think that we are starting to collaborate a lot better than it used to be. I think that agencies are starting to talk a lot more. I think that one of the good things that has come out of recently is that the conversations are happening more. We are really focused more on this particular issue, and that the agencies are much more willing to work together. So I do think collaboration has gotten a lot better over the last year, I would say to year and a half. When I really started digging into this about 3 or 4 years ago, it was bad. Like, no one talked to anybody, but it has gotten a lot better.
And I would say that from the state level perspective, DCBS has been somewhat involved because they do provide behavioral health services out of that department, but also the Department of Medicaid has been very instrumental. They have put in a lot of different policies over time that help make things easier for folks. So for example, Kentucky has made it so that you can get an ID for free if you're unhoused. And, you know, we did a lot of work a couple of years ago with Medicaid and the Department of Justice about how Medicaid gets turned off and back on when somebody's incarcerated. So I've done a lot of work at the state level in terms of through academia and research and public health, but not necessarily directly currently. But we do rely on social services, and case managers do have good relationships with other social service, that level of DCBS and using the services there. So, all right, I think we have time for one more question. Yeah. Okay.
Someone start.
First, thank you guys for being here and taking the time out to come speak with us. You mentioned briefly, like, the concept of a living wage. I'm actually an out-of-state student, and I'm from Illinois, and our minimum wage was $13. I remember working for $13 on campus here. It's $15, and I think throughout the city of Louisville, the actual state minimum wage is at $7.25, but I would say it's more of an expected, like, $14. I was out to dinner. I saw a sign to work at the zoo for $17. What do you guys think is a fair and would actually, like, help people? Like, what do you think is a fair living wage or fair minimum?
I think there is a it's not our opinion. I think that to live in Louisville, I mean, it does matter where you live, that the median wage is about $21 is probably a family supporting wage based on median wage here and based on cost of living and rents.
Okay.
I was just curious, with fighting this ongoing crisis over the recent years, what has been the biggest accomplishment or greatest advancement for you guys?
Wow. Greatest accomplishment. I think the biggest accomplishment that I feel like we've made, it has been, when we opened the Arthur Street Hotel, and we literally were taking people off the streets, putting them into the hotel, and moving them into permanent housing. And we proved a model that actually worked. We weren't taking, we were doing it all on our dollars, private money. And we showed how inexpensive it really is in comparison to what it was taking nonprofits to do it, because they were chasing grant money. And I wanted to see what it actually really cost. And in the first year, we housed like 160 people. That was a really great accomplishment, and we've housed a lot. But what it really did was it really sparked, for me, it sparked the conversation of taking chronic homeless and getting them off the street. At the same time, we were working on Sheehan Landing and developing that project, which is permanent supportive housing, and getting 90 people into permanent supportive housing, which is a huge accomplishment. And we moved how many from the hotel to Sheehan Landing? And then we've got the affordable housing that we also built, which were a lot of 30% units. And it proved in Louisville, our greatest accomplishment at LDG, and for me, that there is a whole pathway from chronic homeless to the hotel, to permanent supportive housing, and into housing. And there is a place for everyone. It's just not on the streets. And we can figure it out.
Thank you.
Hi, I just want to start off by thanking the panel for being here. Ryan early on mentioned that incarceration is expensive, and this isn't really always the case, especially for private prisons. A lot of them run at a profit. Alabama's prisons and Arizona's prisons are a good example of this. They really rely on the prison industry, and I just wanted to ask you, do you think that prisons could potentially, the prison industry in Louisville and in the state of Kentucky could grow and kind of outcompete this system that you have?
I think that, well, within the state of Kentucky, there's not much in the way of private prisons. I think there's one, maybe. There's a history of them being run extremely poorly and with some pretty terrible consequences. And I say this in the Center for Free Enterprise, but I am not somebody. I think that generally speaking, if we take an institution that is something that kind of, housing people in cages is expensive, and to do it humanely is going to cost money. And at any point when we decide that we want to make that create profit, we are going to do it at the expense of the humane conditions. I think it's just kind of a necessary consequence of it. There are certain things that are going to be expensive to run and can't turn a profit. And one of those things, I think, is incarceration. And so that part of that is why I'm very much an advocate for decreasing incarceration overall and not increasing it. But I think we have kind of models all over the country of private prisons not being run particularly well and not having a particularly strong oversight system. here in Kentucky, like I said, most everything that we have is run by the state. Not that any of that's run all that well either, but certainly I think that I have not seen any world where there is a model where we can turn that into a profit-making enterprise, and I think it's a real bad idea to try.
So, Rebecca, this is just a point of clarification for me. You said $21 an hour is the wage for to support a family. Could you clarify what's a family?
Yeah, there's all sorts of variations.
And are you including benefits or benefits on top of that? Because I hear a lot of politicians say, this is a great job, it's $21 an hour, but they're including benefits and they count the benefits as being 30% of that $21 an hour. So what are we talking about here? And of that $21 an hour, then, and that equates to $43,000 a year, how much of that do you allow for housing?
Well, housing is supposed to be a third of your paycheck a month.
A fourth, but now a third.
It's been a third for as long as I've been working in economic development, but the $21 you can pick apart. So basically there are formulas for if there's one wage earner in the household or two wage earners, and then how many kids you have. 21's, I think, the simplest one, but it goes up because I think the 21 is based on one wage earner for a family of four.
Thank you guys for being here. For the past several years here at the business school, we have a program. It's an introduction to management where we have a partnership with Central High School. As part of the capstone project, they have to address the idea of homelessness. And that, of course, the idea behind that is to get young people involved in trying to develop public policy about this. So they've studied the Arthur Hotel. They know about they've started to get a grasp of it. One of the things that I was surprised at, and I was just hoping you all would speak about this, is a number of young people who are in schools, public schools, who are actually dealing with homelessness. It was a shocking revelation to have students in our class who were not housed. And so I was just thinking that you might want to, because it's impacting it's impacting the University of Louisville. But I was just wondering if you all might address this sort of unseen force that is impacting the future.
Family homelessness is largely unseen because families are very nervous about admitting their lack of stability and that then the system would take their kids away. And so families are very hesitant to ask for help. They frequently stay in cars or are couch surfing. In the world of HUD homelessness, so what the federal government defines as homelessness, couch surfing doesn't count. It has to be that you are living in an emergency shelter or in a place not meant for human habitation, like a car. So couch surfing, or if you can pay for your own hotel stay, then you're fine. You're not homeless. We know that that's not true. School systems do have a different definition of homelessness that includes that. And I will tell you, bus drivers know who the homeless kids are. Bus drivers know who's unhoused because they pick them up at different places.
And if you're talking about college kids are a huge issue, and they don't qualify for any affordable housing tax credit units. That's another public policy that we need to change, because that is a problem. If you are a full-time student, you don't qualify.
Last one.
Last question.
I just want to thank you all for being here. I really like hearing all the different policy issues and all the different perspectives. And I'm also interested, you mentioned Milwaukee, so I don't know if that's a model of a city that's doing a good job. I'm curious to hear a little bit more, if anyone has anything to share about how Milwaukee's doing or what they're doing or why they are mentioned. Or alternately, if you would like to answer this question that I like to think about, and I think anybody should be thinking about it. If we're trying to get somewhere, we need to know where we're going. So I would be curious, if you have an answer, what would an ideal all, this is hypothetical. So obviously we've been talking about all the barriers and obstacles, but in the grand scheme, if you could have it your way and we could fix this somehow, taking, all of those things that we've mentioned and just erasing them for a minute, what would the vision look like? If anyone cares to answer that, I would really like to know, what you think a vision of a response to this would be.
Can I take that one? Yeah. So my perfect vision, if I could just say I could get everything I wanted, is we would have enough housing, the right kind of housing, because you can build all the housing in the world, but if you don't build the right type of housing for all the needs, it's not going to do any good. So we need assisted living housing. We need mental health housing. We need enough affordable housing. We need enough permanent housing, and it has to be free housing for the people who need it. We would have enough caseworkers. We would take the time to do transitional housing, to put people in temporary housing long enough to figure out where they need to go. And we would have enough workers to do that and the money to do it and the police and government support behind it and not criminalize it.
Yeah, and if I could add to that, just what I would add is that at every step along the way, the person that is being impacted has the autonomy to decide what it is that they need and what it is that will help them the best.
Yes.
And so that's one of the things that I like a lot about Arthur Street. And I sat and spoke with somebody who was, who I think still is residing there. And one of the things that he cited, and actually the top thing that he cited, was that he got to make his choices. And I think that at the end of the day, I have a little bit of oppositional defiant disorder. When somebody tells me I can't have something, I get real mad about it. That's true of a lot of my clients, and I think that's true of a lot of people. And I think that that's something that's in some ways a little bit fundamentally American. And so one of the things that I think that gets left, I think, outside of the conversation about housing first is how important that individual specific autonomy is to a person and how that impacts the ability for something to succeed. Forcing somebody into treatment can get their foot in the door, but it's not going to work if they don't want to be there, and they're going to have to get to the point where they want to be there. And I have seen a lot of trying to hit them over the head with a hammer by throwing them in jail or whatever, and it resulting in just more defiance coming back. And so that individual autonomy is super important.
Okay, well, I want to thank you everybody for coming, but I really want to thank our speakers. This is wonderful. Thank you very much.